Okay, allergic reaction to medications. This happens not too infrequently, and what we usually see from this are a couple different things. Anaphylactic reaction is a big problem. I've never seen that. That's really not common after just taking oral medications. But I have seen what's more common, a drug rash. And so you can get a rash after surgery just from the medications. And I think most commonly is the antibiotic. Because what I'll do is if somebody's, let's say, on day 3 after their surgery and they come in and they've got a rash on their skin, I'll say, all right, let's just stop the antibiotic. Now, it's safe to stop the antibiotic because the most important dose of antibiotics you've already received. You've received that when you were going to sleep during surgery. We give you antibiotics in your IV. That's the most effective one. So it's safe to stop them afterwards. And usually the rash it's a drug rash and it'll just clear up after stopping the medication. Now, typically patients will just use over-the-counter 1% hydrocortisone or 2% hydrocortisone. Over-the-counter, apply it, and that will help with the itching and that helps the rash feel better. The rash will go away either way if you treat it with hydrocortisone or you didn't. It'll go away faster with the hydrocortisone and it'll decrease the itching. There is another reaction that you can develop after taking a oral medication. We see it again with antibiotics, and I've seen it most oftenly with Bactrim. I don't know if that's really valid or not, but I've seen it most common with that, where patients will complain of tingling of the tongue or numbness or swelling of the tongue. That one always scares me because that can be more swelling in this area, which can lead to swelling of the airway, which can be a problem. A drug rash is really not going to harm anyone. It's miserable, it's uncomfortable, but you're not going to have a problem from it. But if you have throat swelling or very bad tongue swelling, that can be a problem. So if you notice any of that tingling or swelling, notify your physician immediately, and most likely they'll say, okay, stop the antibiotic, and they'll give you some steroids and they'll observe you to make sure, because you don't want that to progress to something more problematic.